Hey guys, welcome to my YouTube channel. This is Jay Patel and I am a certified physician assistant here at MyFitMed. Here I cover multiple topics to improve your overall health and fitness, and the topics may include hormones, vitamins, weight loss, and overall lifestyle changes. The goal is not to treat you but to educate you to help you get in the best shape of your life. Enjoy the video. So today I'll discuss about if there is any correlation between erectile dysfunction and cardiovascular health. In my previous video, I have discussed about the mechanism of erectile dysfunction. The main reason of erectile dysfunction is poor blood flow or vascular problem. A vascular problem may have multiple reasons. In the past, it was believed that the vascular problem was due to a plaque buildup in the arteries, which is why ED was linked to cardiovascular diseases. But the expert now believes that erectile dysfunction and cardiovascular diseases are due to the dysfunction of endothelial lining, which is the inner lining of a blood vessels. When the endothelial lining is damaged or cause any type of vascular problem, leads to a poor blood flow in the penis, causing erectile dysfunction. Same thing when the endothelial lining in your heart is damaged, leads to a heart problem. So having a erectile dysfunction due to vascular issue in your penis may also be a sign of vascular issue anywhere else in your body. Other thing is erectile dysfunction and cardiovascular diseases also have common risk factors, including diabetes, smoking, alcohol, hypertension, high cholesterol, obesity, and low testosterone. Erectile dysfunction may be an early warning sign of current or future cardiovascular problem, and vice versa. If you have a cardiovascular problem, improving your overall heart health may improve the symptoms of erectile dysfunction. Now, being said that, erectile dysfunction does not always indicate the cardiovascular problem. However, men with no obvious cause of erectile dysfunction like trauma or hormone imbalance or neurological problem, and who have no symptoms of any cardiovascular issue, should always get a full cardiac checkup prior to starting any ED medication or any treatment for erectile dysfunction. Thanks for watching. Hope you learned something about optimizing your overall health. Talk to your medical provider before starting any treatment. Let us know what other topics you want me to cover. Give us a thumbs up if you like the video and subscribe for more videos.